by returning to a tiered approach, applying the toughest measures to the parts of the country where cases and pressure on the NHS are highest, and allowing greater freedom in areas where prevalence is lower. While the strategy remains the same, the current epidemiological evidence and clinical advice shows that we must make the tiers tougher than they were before to protect the NHS through the winter and avert another national lockdown. So we've looked at each of the tiers afresh and strengthened them, as the Prime Minister set out on Monday. In Tier 1, if you can work from home, you should do so. In Tier 2, alcohol may only be served in hospitality settings as part of a substantial meal. And in Tier 3, indoor entertainment, hotels and other accommodation will have to close, along with all forms of hospitality except for delivery and takeaway. Mr. Speaker, I know that people want certainty about the rules they need to follow in their area. These decisions are not easy, but they are necessary. We've listened to local experts and been guided by the best public health advice, including from the Joint Biosecurity Centre. We set out the criteria in the COVID-19 winter plan, and we published the data on which the decisions are made. As the winter plan sets out, the 5 indicators are the case rate in all age groups, in particular cases amongst the over 60s, the rate at which cases are rising or falling, the positivity rate, and the pressures on the local NHS. When setting the boundaries for these tiers, we've looked not just at geographical areas, but the human geographies which influence how the virus spreads, like travel patterns and the epidemiological situation in neighbouring areas. While all 3 tiers are less stringent than the national lockdown that we're all living in now, to keep people safe and to keep the gains that are being made, more areas than before will be in the top 2 tiers. This is necessary to protect our NHS and keep the virus under control.